I started my 8 months as a nurse practitioner working in long-term care. I was doing neuropsychiatry at the time, but part of that is assessing cognitive states of my patients. And anyone who has been trained in medicine knows that older adults with UTIs present with delirium and confusion. So many of my patients were put on repeat antibiotics over and over and over again, transferred from the hospital, came back, transferred again a couple weeks later. I advocated for these patients to be started on vaginal estrogen. I was met with so much resistance. So I finally put the data on the hospitalist, urologist, and primary care's desk saying, please read this. Please read this. None of them would read it. And I got the same response over and over and over again. Oh, you're so young. Welcome to medicine. Okay, yeah, we've never done that. And we won't be doing that. Cute little nurse practitioner. Women, you advocate for your women patients. So cute. Oh, your psychiatry, neurology. Okay, stay in your lane. How about that? How about you read some data so your patients stop dying? Okay. I know this may shock them, but it was a requirement of my doctoral program to be able to read. It was. I know. Shocking, right? Nurse practitioner program, you have to read and interpret data? Never heard of it. I explained to them over and over again. This is not my recommendation. I read the data. I read it with my eyes. And if you think it causes clots, then I already know you did not read the data. I understand you've been in medicine for a long time and you know so many things that I don't. So many. They all were men, I guess. Maybe that was my mistake there. Anyways, clinicians, if your patients have vaginal atrophy and are getting recurrent UTIs, give them vaginal estrogen. If you're not sure how to write the prescription, reach out to me and I will tell you how to write the prescription. It's super easy. And if you are a granddaughter or someone yourself that is having recurrent UTIs, I don't care how old you are, you could be in your 20s. This data also showed in your 20s. I don't care what age you are. If you're a woman and you're having recurrent UTIs, vaginal atrophy, dryness, please advocate for yourself to your provider. And if they will not prescribe some kind of local vaginal estrogen for you, find someone that will, because it's supported by data. It's supported by the American Urology Association in the 2025 guidelines last year. And happy living and less death. Yay, women not dying.